Hindi kami pareho.
Okay, so good day, ma'am. I'm Chloe Paula Corono Pante from BSN1I. Today, I'm going to perform on how to assessing the client's skin, hair, and nails. So, the assessment is to the structure and functions of the skin, hair, and nails, and then the risk factors for skin cancer, and then the drug resistance across cultures, and ways to reduce one's risk. And also the physical examination. When assessing the skin, hair, and nails, and then differentiate between the normal and abnormal findings, and also findings frequently seen when assessing the older client's skin, hair, and nails. So the equipments are clean gloves, and then a pen light, and then a centimeter ruler, and also adequate lighting, and then the room temperature. So now is the knowledge, the preparation is prepare the client and also the necessary equipment, and then the ano yan um, yan describe the two physical examination techniques when describe the two physical examination techniques when assessing the skin, and also the um Okay, so the preparation, so the knowledge is prepare the client and then the necessary equipment, and also the two physical examination techniques when assessing the skin, and then describe changes that are common with aging of the skin. So now the procedure. So good day, ma'am. I'm Chloe, your student nurse from Camarines Sur Polytechnic Colleges. May I know your name po?
Ma'am Pay.
Okay, so Ma'am Pei, today I am going to assess your skin, hair, and nails. So, ang purpose po nito ay para malaman po natin kung meron any problem sa iyong skin, hair, and nails. And also para po um, ma if meron man po is at least po maalertahan po natin agad. Ayan. So, now is perform hand hygiene. And after that is hand the client with patient gown if possible. And then provide the client's privacy. Yeah. Assume that I provide the client's privacy. So now the assessment is okay. So ma'am, today is I'm going to ask you any further questions lang po. Ano? So ma'am, gumagamit po ba kayo ng ng mga lotions or any chemicals na nilalagay po sa okay. So, note any distinctive odor when assessing the client. Ano. And also, kailan po kayo natutong magamit po ng mga skincare or ano?
Since I was grade 7, I guess. Yes,
Okay.
grade 7.
Okay, so after that is it's time to inspect and then palpate the client's skin first. Okay, so ma'am, pwede po ba kayong ganito lang? And allow me to palpate your and inspect and then palpate your skin. So don't but before that, ma'am, all the data that will be collected is provided we provided a privacy naman po, no? Ang nakakaalam lamang po nyon ay ako at ang other physician. So, is that okay with you, ma'am? I am going to guide you throughout the assessment naman po. All you need to do is to follow my instruction. Okay, so ganun po ulit tayo. Okay? And then, first is note the first is inspect the client's generalized color variations, and then the skin breakdowns, and also the primary, secondary, or vascular lesions. So, inspect. Okay. So, as I inspect the client's skin, hindi naman po siya dry and then hindi naman siya masyadong um, madaming wala naman siyang scars or any peklat na present. So, ma'am, may allergies po ba kayo? Okay, wala. So, walang allergy ang client. So, ibig sabihin, wala siyang reaction kapag kumain man siya ng kahit ano. Okay, so next is to palpate the client's skin for lesions and also the the temperature and yan, so temperature. So using the three middle fingers. So palpate. Yeah. So okay, ma'am. So if the client has any presence of lesions, then palpate for its texture if it is rough or smooth. So since my client is no presence of lesions naman po, so okay po yun. So wala pong problema. And then next naman is the palpate for temperature using the posterior part of the fingers. So, okay. Ito pa. Okay, so the temperature of the client is warm. Hindi naman po siya malamig and also masyadong mainit. So, warm lang po. And after that is um, palpate or pinch up the client's skin if the sternum and also under the clavicle if palpate for turgor and then mobility and also palpate for 5 to 10 seconds for the presence of edema. Okay, so ma'am, I will pinch your sternum po. Okay, and also the clavicle, under the clavicle. Okay, so ang skin po ng client is normal, so there is no presence of um, pang ano po ng skin, yung parang pag-stay po, yung parang elasticity. Yan. So, and also the edema for ano um, for 5 to 10 seconds sa ankle and then sa tibial. Okay, so now. Okay, so I will palpate the client's ankle and also the tibial part. So, okay. Okay, so as I palpate the client's tibia and then the ankle, there is no presence of edema. And also, after that is palpate and then inspect and palpate the client's scalp and also the hair. So, ma'am, pwede po ba natin tanggalin mo? Okay, so, kailan po kayo ma'am nagpakulay?
Last week.
Okay, so last week. Mga pang-ilang pakulay nyo na po kayo yung ano nyo? Mga ilang beses na po kayo nagpakulay?
Simula nung nag-start,
Mm-mm.
I don't know, hindi ko na mabilang, madami ng beses.
Madami ng beses. Okay, so today ma'am, I am going to inspect and then palpate your hair distributions and then the color and also the texture. And then, ay papalpate ko pa din po if it is oily or rough or thickness and then the if there are any presence of lesions or parasites. Okay, so ma'am, pwede po ba kayong harap sa akin? Okay, so as I observe the client's hair and also the scalp, there is no presence of lesions or even parasites. But the client's hair is masyadong rough po kasi since it is a fresh, bagong pakulay pa lang po. So, and as we can see, medyo nagla-light ng color po siya. Yan, nagre-reflect po siya sa light. Okay, so next is the inspect and palpate the client's nails, fingers and nails. So, ma'am, can you, yan, your hands. So, I will inspect your nails, your finger nails po for grooming and then the cleanliness and also the color and then the shape. Okay, and also the capillary refill po. Okay, so this one is, okay, so and also note of its duration when we assessing the for capillary refill. Ano, example po, dapat the normal range lang po na duration is about 3 seconds. So, kapag lumagpas po ng 3 seconds, it means may problema po sa circulation ng client. Okay, ng blood. Okay, so, okay, so thank you, ma'am. So, as I inspect and palpate the client's nails and then the fingers, so as I observe, there are no presence of any cutics or any chemicals na nasa kuko po ng client. And also, the capillary refill is sa nasa 1 second po siya nag-refill agad. So, ma'am, thank you for your cooperations po. I will record the data po. And also, ang gaya nga po ng sinabi ko, lahat po ng information from you is ako lang po at ang other physicians ang nakakaalam. So, thank you for your cooperation. Okay.
Basta na ko na yun?
Yeah.